Hello everyone, welcome to my YouTube channel Pharma Researcher. So in today's video, I will be explaining the JIPMER Pharmacist previous year question paper that was held in the year 2014 with complete English explanation. The same questions has already been with Hindi explanation. Now this video will be in complete English explanation. So let's start with the first question. So the question is, a patient brings in a vial of cloudy regular insulin and the examination of the medication profile reveals simultaneous use of NPH and regular insulin. So which of the following is the most probable explanation for the cloudy appearance? So the question is simply asking that a patient is carrying with him a vial of regular insulin which appears to be cloudy, and when the examination of the medication profile done, then it reveals that there is a simultaneous use of NPH, that is neutral protamine hagedorn, and regular insulin. So we have to find the reason due to which the regular insulin appears to be cloudy. So first discuss about the NPH. What is NPH? So NPH is neutral protamine hagedorn. So it is a special preparation of regular insulin, and in this the protamine suspension. So this protamine suspension allows for slower release of the insulin after injection. So the NPH insulin can provide long-term control of metabolism, and the effect of NPH insulin lasts around 10 to 14 hours, and it lowers the blood glucose level within 1 to 2 hours. So the reason behind the cloudy appearance of this regular insulin is that the insulin has been contaminated. So option C will be correct for this question. The next question is, which of the following should be reported to the prescriber an adverse drug reaction to the montelukast? So we have to find among these that which one is the adverse drug reaction to montelukast. First, let us know about what is montelukast. So it is an anti-asthmatic drug. So it is basically a leukotriene receptor antagonist and used in mild asthma. So the most common type of side effects that can be seen with the montelukast are like upper respiratory infection, fever, headache, sore throat, ear infection, sinus infection, runny nose, stomach pain, diarrhea, etc. So these are the several common side effects that are associated with the use of montelukast. So among these four options, the main adverse drug reaction that is seen with the use of montelukast is an increase in respiratory tract infection. So option A is correct for this question. The next question is, which one of the following oral medication should be administered with food? So these are several oral medications for different purposes. So we have to find that which one will be given along with the food. So the drug that is secukinumab, which is an antiviral drug, so it is administered along with food. So the main reason for several drug to be given with food is due to because they the side effect of stomach irritation, including indigestion, stomach inflammation, or ulcers. And also one more important use is, we can say that it also allows to maximize the bioavailability of the drug. And if I'll talk about atenolol, so atenolol is given before bedtime. And if I'll talk about fluconazole, then fluconazole is either given before meal or either given after meal. And if I'll talk about levofloxacin, then it can be given 1 hour before or 2 hours after eating. Then we can move to the next question. So next question is, a pharmacist calls the physician to report an increase in INR for a patient on warfarin protocol. Which one of the following drugs is most likely to account for this observation? So, in this question, they are asking that a patient which is having a warfarin medication, so it has been seen that there is an increase in INR. INR is international normalized ratio. So there is increase in this ratio, INR ratio. So we have to find that what is the reason behind the increase in INR. So simply INR is international normalized ratio. So when INR levels are increased, that means that our blood will take longer time to clot. So the drug C14, that is option A. So what this C14 do? So it interacts with this warfarin. It interacts with warfarin to increase a patient's INR value more than commonly administered antibiotics for UTI treatment. So this is the reason that the patient which is on warfarin protocol has increased in INR levels. So option A will be correct for this question. The next question is, a patient weighs 148 lb is to receive enoxaparin 1.5 mg per kg subcutaneously daily for 7 days. Calculate the total daily dose. So patient having a weight 148 lb, that is in pounds. So he is receiving enoxaparin. So enoxaparin is used to prevent blood clots in the leg in patients who are on bed rest, or either they are having hip replacement or knee replacement. So in that case, enoxaparin is given. So the dose is 1.5 mg per kg subcutaneously daily for 7 days. Now we have to find the total daily dose. So there is a simple formula to calculate the total daily dose. So total daily dose is equal to weight of the patient multiply by dose. So simply we will formula here. Here we have the weight of the patient and we have the dose given. So for weight is given in lb, that is in pounds, but dose is given in mg per kg. So either we have to change this unit to this, or we have to change lb pound in kg. So it is easy to convert the weight from pound to kg. So the simple formula to convert weight from pound to kg is simply write the value of the weight, that what number of weight is given in pound, then divide this value by 2.2, and by dividing 148 by 2.2 it simply gives 67.27. So now simply we will put this value in the total daily dose formula, that is weight into dose. So weight we are having 67.27 and the dose is 1.5. So after multiplying these two values, we will be getting 100.9 mg. So option B will be correct for this question. Then coming to next question. So next question is safe anti-emetic drug used in morning sickness. So we have to find among these which drug will be used or considered as a safe anti-emetic drug in morning sickness. So the drug dimenhydrinate, which is an antihistamine drug. So it is simply metabolized into its active ingredient diphenhydramine to obtain the anti-emetic efficacy. So if I'll talk about diphenhydramine, so it's simply used to relieve the red eyes or irritated, itchy and watery eyes, and also used in common cold. Then we can move to the next question. So the question is, local injection therapy for erectile deficiency may include. So we have to find among these drugs that which is given in the form of local injection therapy for the treatment of erectile deficiency. So the first drug, that is sildenafil, so it is given by oral route, and it is also used in erectile dysfunction, and it acts as a PDE5 inhibitor. Sildenafil, it is an important question that how sildenafil shows its action, or what is the mechanism of action behind sildenafil. It is an important question. Then if I'll talk about prazosin, so it is an antihypertensive alpha blocker, and it is also given in oral form. Then yohimbine is alpha 2 adrenergic blocker, and it is also used in mydriatric, and also in the treatment of impotence or erectile dysfunction, and it is also given orally. And the drug L-prostadil, so it is given IV in the form of injections, and it is a vasodilator that can increase the blood flow by expanding the blood vessels, and this medicine causes an erection because it increases the blood flow to the penis. So option D will be correct for this question. The next question is QT prolongation occurs with. So the QT prolongation occurs with option B, that is gefloxacin. So there is a cardiac cycle diagram like this, in which I will show you the QT time. So this is P, this is Q, this is R, this is S, and here this is T. So this is the PQ interval, this is QRS, this is PR, and this is QT interval. So the normal range in men for QT interval is 45 seconds. In women it is 47 seconds. So what happens with gefloxacin? So it increases this QT time. So this graph will appear, this goes from here. So it will increase the QT prolongation, affect the rhythm. The next question is, which one of the following is an ultra short acting beta blocker? So in this, the drug esmolol, which is also known as Breviblog, so it is given intravenous, and it is an ultra short acting beta blocker, mainly used for cardioselective, or it is mainly considered as cardioselective beta blocker, and it is having T half of just 9.2 minutes. The next question is, which one of the following is effective in pneumocystic carinae infection? So the drug cotrimoxazole, which is a combination of trimethoprim and sulfamethoxazole, so it is used as an effective agent, effective drug in case of pneumocystic carinae infection. If I'll talk about ketoconazole, so ketoconazole can be used in case of candidiasis, blastomycosis, and histoplasmosis. And the drug metronidazole, so it can be effective against both gram positive and gram negative bacteria. If I'll talk about gram negative bacteria, so in gram negative bacteria it is effective against Bacillus fragilis, and in gram positive bacteria it is effective against Clostridium difficile, which is an important Clostridium difficile. Then if I'll talk about fluconazole, so it is effective against endemic fungi, histoplasma, blastomyces, and coccidioids. So the correct answer for this question is option C, that is cotrimoxazole is effective in pneumocystic carinae infection. Then next question is, a solid or semi-solid mass meant to be inserted into body orifice is called. So a dosage form which is solid or semi-solid in nature, and it can be inserted into the body through orifice, or we can say through body cavities. So this is suppositories. Suppositories are the semi-solid dosage forms which are inserted into the body cavity. There are different types of suppository. First one is, we can say, rectal suppositories. Then we can say pessaries. Pessaries are given by vaginal route. Then bogies. For bogies, they are mainly given by urethral routes. Then nasal bogies, they are given by nasal route. And then we can say ear cones, which are given through ears. So in this important term, one important term is enema. So enema are the injections of fluid that are used to clean or stimulate the emptying of your bowel. So option C will be correct. That is, suppositories are the semi-solid masses that are meant to be inserted into the body cavity. The next question is, 1 tablespoonful is equal to. So 1 tablespoonful is equal to 15 ml. Option A is correct. There are more important parameters that can also be asked in the exam, like for 1 drop. So 1 drop is equal to 0.04 ml. Then 1 teaspoonful. So 1 teaspoonful is equal to 4 ml. Then 1 dessert spoonful. Then 1 dessert spoonful is 8 ml. And 1 wine glass full, if I'll talk about 1 wine glass full, so it is equal to 60 ml. So these are more important things that you must know. Then we can move to the next question. So the next question is, 1 milli equivalent of KCl having molecular weight 74.5 grams is equal to. So the simple formula to calculate the mgs is equal to, mg is equal to milli equivalent multiplied by molecular weight divided by valency. So simply we can put the values over here. We have to find the mgs, and milli equivalent is given as 1, molecular weight is 74.5, and valency of potassium is 1. So the simple answer will be 74.5 mg. So option C will be correct for this question. The next question is, how many grams of water are needed to make 150 gram of 4% weight by weight solution of potassium acetate? So we have to find the grams of water. How much we have to make total? Total we have to make 150 grams, in which 4% weight by weight is potassium acetate, and we have to find the grams of water. So simply if we have given, we are making a solution, then we are using two things. One is water, other is potassium acetate, and total we are making 150 grams. So simply we can consider water as A plus potassium acetate as B, and total grams. So B is given 4% in the form of percentage. So from total value, potassium acetate used is 4%. So simply we will calculate the B, that is 4%. So B is 4% of 150 grams. So we will convert the 4% into numbers, that is 4 divided by 100 into 150. So answer will be 6. Now simply we will put the equation A plus V is equal to 150. A plus B is 6 equal to is 150 minus 6 is equal to 144. So option D will be correct for this question. Then next question is water for injection is. So water for injection is simply the sterile water free from pyrogens. Option C will be correct for this question. The next question is in the prescription the abbreviation SOS indicates. So the abbreviation SOS in the prescription indicates simply when necessary or when needed only. So option B will be correct for this question. The next question is which of the following factors is associated with an increased risk of non-compliance in the elderly? So we have to find among these the factor which is associated with the increased risk of non-compliance in the elder patients or elder population. So the factor is polypharmacy. So if I'll talk about what is polypharmacy, so polypharmacy simply refers to using 5 or more medications based on a review of current data. So the main objective of polypharmacy is to target the geriatric patients or we can say elder patients who are suffering from one chronic disease with the possibility of concurrent comorbidity or several other diseases may also be affected, may also have affected the patient. So option A will be correct for this question. The next question is which equation is used to predict the stability of a drug product at room temperature from experiments at accelerated temperature? So we have to find the equation which is used to predict the stability of a drug product. So the equation is Arrhenius equation. So option C will be correct for this. If I'll talk about Stokes equation, so Stokes equation generally describes how certain factors affect the rate of settling or rate of sedimentation in a dispersed system. Then if I'll talk about Young's equation, so Young's equation is mainly we can say valid for three-phase systems in thermodynamics, equilibrium for ideal solids or pure liquids. Then if I'll talk about Michaelis-Menten equation, most widely used equation in pharmacy in every subject for reaction kinetics. Then we can move to the next question. So the question is the adult dose of a drug is 250 mg. So what would be the appropriate dose for a 6-year-old child weighing 60 lb? So adult dose is given, that is 250 mg. Age is given 6-year-old, weight is given 60 lb. So we can find out the dose of a child, or we can simply say we can find the child dose by using Young's formula. Young's formula to calculate the child dose, that is child dose is equal to age in years, age in years divided by age in years plus 12 into adult dose. Simply we can put the values. Age in year is given 6 year, 6 plus 12 multiplied by adult dose is 250 mg. So after calculating these values we will get the final value 83.3 mg. So the most appropriate among these is option B, that is 83 mg dose is the right answer for this question. The next question is all are safety techniques observed while dispensing the drugs except. So we have to find that which of the following is not the safety technique while dispensing the drugs. So for this, option C will be correct, that is, do not consult the doctors. The next question is, all the drugs given below may require therapeutic drug monitoring except. So here we have to find that which drug will not require therapeutic drug monitoring. So firstly, I'll explain what is therapeutic drug monitoring and when it is needed to have therapeutic drug monitoring. So therapeutic drug monitoring is the process. It is simply a process by which the effect of a drug is monitored by simply measuring the plasma concentration of the drug. So it is useful in several conditions, like if there are some drugs which are having low safety margin, like theophylline, digoxin, lithium. So in these cases we can use therapeutic drug monitoring. And also in case of poisoning, or if individual variations are large, and also in case of toxic drugs and antimicrobials, then we can use the therapeutic drug monitoring. Now there are several conditions when therapeutic drug monitoring is not used or not useful, or we should not needed the like when the drugs whose response is easily measurable, like there are few drugs whose response we can measure very easily, then several drugs that are activated in the body, like several products, then some drugs whose effect lasts longer, then several drugs which are having irreversible actions like anticholinergics. So in that case we should not use the therapeutic drug monitoring. So option D will be correct for this question. The next question is filgrastim is. So what is a filgrastim? So filgrastim is simply a synthetic form of colony stimulating factor, and it is used as an injection to treat the neutropenia that is caused by cancer medicine. If I'll talk about the neutropenia, so neutropenia is simply the when the white blood cells are decreased in number, and it helps. What it does, filgrastim helps the bone marrow to make more white blood cells. So option B will be correct, that is, filgrastim is a granulocyte colony stimulating factor. The next question is, the branch of pharmacology that study the inherited difference in drug response in the population or ethnic groups is called. So the branch of pharmacology that study the inherited differences in drug response in the population or ethnic groups is called pharmacogenomics. Option C will be correct. If I'll talk about clinical pharmacology, so it's simply the study of drugs in humans. Then pharmacoeconomics, so it is a branch of economics that uses the cost benefit, cost effectiveness, cost minimization, cost utility, different types of analysis to compare the pharmaceutical products and treatment strategies. Then the ethnopharmacology, so it is an interdisciplinary scientific exploration of several biologically active agents that are observed by the men, or they are traditionally employed by the men. Then we can move to the next question. So the question is, hydroalcoholic solution for oral use containing sugars are called. So hydroalcoholic solutions which are containing sugars are spirits. Option B will be correct. And the alcohol content this is more than 60%. The next question is, creaming and coalescence may affect the stability of. So they will affect the stability of emulsions. Option C is correct. So what is creaming? So creaming is simply the rise of dispersed particles to the surface of an emulsion. And the coalescence is an irreversible process by which two or more droplets merge during contact to form a single droplet or single daughter droplet. The next question is OTC drugs means. So OTC are over the counter drugs which do not require prescription to be sold. So option B will be correct, that is the drugs which can be dispensed on the patient demand are OTC drugs. The next question is auxiliary labels do not contain an information like. So the auxiliary labels that are used to provide the supplementary information regarding the safe administration, use and storage of the medication by the pharmacist along with the prescription that was given by the prescriber. So there are several labels, auxiliary labels that include shake well, keep in refrigerator for external use only. So these are the auxiliary labels. So option D, that is take one tablet 4 times a day for 10 days. It is not an auxiliary label, rather it is provided by the physician to the patient or to the pharmacist to convey to the patient. So option D will be correct. The next question is artificial tears may contain. So artificial tears contain carboxymethylcellulose. So there are different other substances that can also be present in the artificial tears like dextran, glycerin, hypromellose. So there are several different drugs that can be used in artificial tears. Then we can move to the next question. So next question is in DTP vaccine P corresponds to. So the term DTP, it stands for diphtheria, tetanus and pertussis. So P is pertussis and the another name for pertussis is whooping cough. So option B will be correct for this question. The next question is the following are drug therapy problems except. So we have to find that which one is not a drug therapy problem. So the adverse effect from a medication, it is a drug therapy problem because when the drug is given, the adverse effect comes from a medication. Then the symptoms caused by under treatment, so this is a drug therapy problem. A drug-drug interaction, if multiple drugs are given, then it will cause some interaction that can be shown in the body, so it is also drug therapy problem. Then undiagnosed condition, so it is not a drug therapy problem, so option D will be correct for this question. The next question is which of the following in the vanishing cream is used for its emollient effect. So if I'll talk about the emollient effect, so emollient effect is simply that softens or soothes the skin. So glycerin is the one that is present in the vanishing cream or used in the vanishing cream for providing the emollient effect to the skin. The next question is if the product has been substituted wholly or partially by another drug, it is known as. So if a drug is substituted wholly or partially by another drug, it is known as adulterated drug. But there is a lot of confusion between the spurious drug and adulterated drugs. In several books, they have mentioned this statement under spurious drug. In some, they have mentioned under adulterated drugs. So there is a two statements that are given for spurious drugs. if I'll say that if the drug is manufactured under the name of another drug, then it is called spurious drug. Most probable statement for spurious drug. What the statement that is it has been substituted wholly or partially or in part by another drug, then it is also spurious drug. But I am giving answer B because the answer is given in the answer key, and in several books it is also given as adulterated drugs. Then if I'll talk about misbranded drugs, so we can consider the drug to be misbranded if its branding or its labeling is not that appropriate. The effect that is mentioned of the label that it will be this much effective, it will not that requirement, so it will be considered as misbranded drug. Or if the color of the tablet is not that good, it is not coated properly, the powder granules are not good, or its polishing is not that good, so it is considered as misbranded drug. And for poisonous drug, if a drug which is poisonous in nature, then it is considered as poisonous drug. So for this, according to answer key, the answer is adulterated drugs, but it can be spurious drug, it can be adulterated drug. The next question is, loss of taste sensation is side effect of the following antihypertensive drug. So loss of taste sensation can be seen with captopril. Option B is correct for this question. So captopril is basically an antihypertensive drug. So option B is correct. So that's all for this video. So let's meet in the another video in which I will be discussing more important questions from different pharmacist question papers or previous year other question papers related to pharmacy. So that's all for now. Thank you very much for listening.